Alex, I see a lot of patients in the clinic that have pain, but they don't know the difference between rheumatoid arthritis and osteoarthritis. What's the difference?
The osteoarthritis patients wear and tear by age 50, which I'm not there yet.
What about rheumatoid arthritis? That's a big difference, right?
Those patients are totally different. Those patients wake up one day and they're suddenly painful, swollen.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
Welcome, Dr. Carrasco.
I'm Dr. Alex De Jesus.
We have an expert today, Dr. De Jesus, who's going to talk about the difference between osteoarthritis and rheumatoid arthritis. Alex, I see a lot of patients in the clinic that have pain, but they don't know the difference between rheumatoid arthritis and osteoarthritis. What's the difference?
You know, this distinction becomes extremely important because the treatments are so different, okay? So the difference is you're going to have patients that have, I'm getting old arthritis, I'm just kind of creaky, joints, and those are osteoarthritis patients. You're going to have patients that are inflammatory patients, swelling and slow me down, and that happens anywhere from 4 or 5 years old until you're an old man. So if you're over 50, you're unlucky, you got both of them.
Okay.
You already have a little bit of the getting old arthritis, and now the rheumatoid arthritis is going to add a burden to that.
All right, so who's at risk? Tell me the difference between, like, the osteoarthritis patient. What's the risk? How young are they? What do they do? What happens?
The osteoarthritis patients wear and tear by age 50, which I'm not there yet, but by age 50, about half of people already have arthritis, osteoarthritis. And as we get older, 60, 70, 80, then your hips, knees, back, spine get arthritic. That's kind of the aging.
They're wearing down. The
wearing down, wear and tear, right? Wearing down.
About rheumatoid arthritis? That's a big difference, right?
Those patients are totally different. Those patients wake up one day and they're suddenly painful, swollen, and they can't make a fist, and they can't get up, they can't straighten up, they can't walk, and they have visible swelling of the joints, particularly the wrists and the hands, visible swelling, and the toes and the feet are going to be swollen. They also kind of feel feverish, and they're tired and fatigued. They don't want to go. They want to stay home.
All right, so tell me, Alex, what happens in this situation?
Okay, let's go over the hand. Let's take a look at this hand. Here we're seeing a hand that has a lot of joints in the wrist, joints at the beginning of the fingers, the metacarpals, has joints in the middle and the distal. Now, all these wrist joints, all these proximal joints, they're all going to become swollen with rheumatoid arthritis. Now the patient has a difficulty making a fist, has letting go, there's no strength in the hand, and it hurts to do that. Well, if you're a lady, it hurts to put makeup on, it hurts to blow dry your hair, it hurts to hang on to the steering wheel. Pretty soon, your activities of daily living and your lifestyle change rapidly when you have rheumatoid arthritis.
Is that a young person disease or an older person disease?
We're looking at most of the patients are diagnosed between age 50 and 55, but it can happen at any other age. And it happens 80% of the time in women, and for some reason it happens 80% of the time in people of Caucasian descent. It's a little bit more common than people that are other races in America.
You talk about diagnosis. How do you make this diagnosis?
Well, the diagnosis could be a little bit tricky at times. The diagnosis requires a combination of clinical suspicion, your physical exam, lots of testing for rheumatoid arthritis, including imaging like sonograms, MRIs, X-rays. You got to put all that together, and then you can have the diagnosis of rheumatoid arthritis. But let's sit down and talk about how we treat this disease.
Yeah, I think, that's a very good summary, kind of what happens with the difference. I see a lot of patients that I send to them because I think they have rheumatoid arthritis and they don't even know it. How are you going to treat this problem?
These patients are not treated with just Tylenol and Motrin. These patients are going to require advanced biological therapies. They're going to require medications that go into the immune system and control the inflammation. And the good news is we have many of those.
And what's the goal?
The goal is low disease activity. You don't look like you have it, or remission. It looks like nothing shows up on x-rays or blood work. Your disease is totally gone.
And if you don't treat it, it's going to get worse.
It's going to progress. So don't let this disease progress. See your rheumatologist on this one, on the rheumatoid disease. You have the potential to totally control the disease.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.